Well, we move to a topic that deserves attention and discussion, especially among caregivers. It's called FTD. You may hear the letters FTD and you think, okay, floral delivery? No. FTD in this case stands for frontotemporal degeneration. It's a disease not many people or members of the medical community even know about or have enough information. Colleen Seymour is here, and she's an advocate for those with FTD, and she's here to share more. Good to see you.
Good to see you too. Thank you for having me.
What exactly is FTD? This is the first I've ever heard of it.
So FTD, it stands for frontotemporal degeneration or dementia. It's the most common form of dementia diagnosed to people under the age of 60. And it's characterized by symptoms of language impairments or behavioral changes or movement dysfunction. So it affects the frontal portion of the brain as well as the temporal parts of the brain.
Is this different from Alzheimer's, and how so?
It is. They're both, they're similar. They're both dementive disorders, so they affect thinking and behavior, but it's different. FTD affects people in their middle age, so 45 to 60 years old, whereas Alzheimer's individuals are elderly in their older age.
I know you're involved because this has touched your family.
Yes. So my mother-in-law, Kelly, was diagnosed back in January of 2016. She's 55.
That's a great picture of her. Yeah, is that her?
She's a huge animal lover. But she was diagnosed in 2016. We started to notice symptoms when she was 53. So things that kind of caught our attention were, obsessive kind of behaviors, some obscure financial decision things that she did. So we went and found a neurologist, and it took about a little over 2 years before we got a diagnosis.
So there are warning signs. And you can find out more about this. There's a website at the bottom of the screen. I want to encourage you to go to theaftd.org to find out more about FTD and those warning signs. So what's your message to families who may be going through something like this with one of their family members?
Sure. My message is stay hopeful. There's a lot of research being done. The Association for Frontotemporal Degeneration, the AFTD, whom I volunteer for, are funding research to find certain biomarkers, indications of this disease to be able to create a more effective diagnosis. Right now, the average diagnosis time is about 3 to 4 years.
Wow,
which
my
is
goodness,
a long time.
That is a long time.
My mother-in-law was diagnosed in 2015, and she's no longer working. She's in an assisted living home. So in 2 years' time, a lot drastically changed. So
you have a free event coming up. Give me the details.
Yeah, so the Association for Frontotemporal Degeneration is putting on a meet and greet tomorrow at the Ross Cherry Creek Library branch from 10 to noon. And it's going to be an informational, open event for anybody who wants to learn more, maybe has somebody affected by it, or even medical professionals. So.
And how's your mother-in-law doing now?
She's doing fine. She enjoys her time. She's at an assisted living home in Ohio, and she enjoys getting visits from her family, my wife's family in Michigan. And and she enjoys doing her walks and playing music, listening to music. So.
Well, you are a very supportive daughter-in-law. She has a lot to be proud of. Thank you for bringing it to our attention today.
Thank you.
The Ross Cherry Creek Library is where you can actually find more information. There's a great informative meet and greet event tomorrow, 10 a.m. to noon. Learn about the frontotemporal degeneration and what you can do in the community. Please go to this website. It's theaftd.org. Theaftd.org. Stay with us. We'll be right back after this.